Many families think that once someone starts hospice, every other service has to stop. That's not always true. Some services do stop. Some services may continue. And depending on your insurance, you may even qualify for additional services while you are receiving hospice care. Today, we are going to clear up some of the biggest misunderstandings about palliative care, hospice care, and what your insurance may cover. Welcome back. Over the last few episodes, we have talked about the hospice team and the 4 levels of hospice care. Today, we are answering another question that families ask all the time. What other services can my loved one receive while they're on hospice? Before we talk about hospice, let's quickly remind ourselves what palliative care is, because many people confuses palliative care and hospice. Hi, my name is Rupal. I'm a hospice and palliative care nurse, and every week I help families better understand serious illness and the healthcare system. One important reminder before we begin. The information I'm sharing today is based on healthcare in the United States. If you live outside the US, your country's healthcare system and insurance rules may be different. So, what is palliative care? Palliative care is designed to work alongside treatments that are meant to cure a disease or help someone live longer. The goal of palliative care is to improve quality of life by helping manage symptoms such as pain, shortness of breath, nausea, anxiety, or other problems that can happen during treatment phase of a serious illness. One of the biggest misunderstandings is that starting palliative care means you have to stop your current treatments. That's not true. Palliative care does not interfere with the other medical care you are already receiving. For example, you can continue seeing your oncologist and receive treatments like chemo or radiation if you have cancer. You can continue seeing your cardiologist, get surgery or a stent placement if you have heart disease. You can continue seeing your neurologist or any other specialist involved in your care. You can continue taking medications prescribed by your doctors. If you are receiving home health services, physical therapy, occupational therapy, speech therapy, rehab, or other treatments that are helping you treat or prolong life, those services can be continued while you're receiving palliative care. In other words, starting palliative care does not mean you have to change everything else you're doing. So how is hospice different? When someone decides to begin hospice care, the goal of treatment changes. Instead of focusing on treatments that are meant to cure the disease or help someone live longer, the focus becomes comfort, symptom management, and quality of life, and not resume the life-prolonging treatments or measures. By the time someone chooses hospice, treatments have no longer been successful in curing the disease, and the patient's life expectancy is 6 months or less if the illness follows its expected course. At that point, comfort becomes the priority chosen by the patient and their family. Because of that change in goals, treatments that are considered aggressive or life-prolonging are stopped. For hospice patients, Medicare or other insurance companies does not pay for hospice care and aggressive treatments related to the terminal illness at the same time. Examples may include repeated hospitalizations for the treatment of terminal illness or related symptoms, chemotherapy, radiation therapy, or other treatments whose purpose is to prolong life rather than provide comfort. Supportive services that were being provided through programs like home health or rehab are also usually discontinued once hospice begins, because the hospice team takes over providing care related to the terminal illness. What other services can you receive while on hospice? This is where many families are surprised. Even though hospice replaces some services, you may still qualify for additional services through your insurance. If you have Medicare or Medicare Advantage plan, sometimes called Managed Medicare, you may also qualify for services such as Meals on Wheels, transportation, adult day health programs, personal care services, home care assistance, and other community support programs. However, this is very important to understand. These additional services are not the same everywhere, even in US. The services available in Texas may be different from those in California. Michigan may have different rules than Florida. Every state has different programs and different insurance rules. That's why I always recommend calling your insurance company directly. Use the phone number on the back of your insurance card and ask, what additional services are available while I am receiving hospice care? That one phone call can sometimes help you discover benefits you didn't even know you had. Now, one may ask, what about commercial or private insurance? If you have commercial or private insurance, your coverage may be very different. Some commercial insurance plans cover hospice very well, like at 100%. Others may have limitations. Some plans may not cover every level of hospice care. For example, certain plans may not fully cover a higher level of hospice care, such as general inpatient care or continuous home care. Sometimes, hospice itself may not be covered at 100%. So if you find out that something is not covered, don't be discouraged. Instead, focus on making the best use of the services your insurance does provide. If your family is financially able to, hospice companies can explain the out-of-pocket cost for the services that are not covered by your insurance. Some hospice organizations also have charitable assistance programs. So depending on your financial situation, you may qualify for help through those programs. Sometimes, families pay only part of the cost. Sometimes they pay nothing at all. So every hospice organization is different. The important thing is this: don't be afraid to ask. Ask your hospice company exactly what your insurance covers. Ask what is not covered. Ask if there are any financial assistance programs available for services that are not covered. It never hurts to ask those questions. Now, what about veterans? For our veterans, things may work a little differently. VA benefits are unique to each veteran. What is covered for one veteran may not be exactly the same for another. Hospice companies are not always given complete details about every veteran's VA benefits. That is why I strongly recommend speaking with your assigned VA case manager who you're usually dealing with before choosing hospice if possible. Ask what additional services the VA may still provide or pay for while you are receiving hospice. If you have both Medicare and VA benefits, sometimes it may be beneficial to receive hospice through Medicare while continuing home care, personal care service, or other approved services through VA. You also have the choice of receiving hospice through your VA benefits, if that is the better option for your situation. This is simply a recommendation that may work well for some veterans. The decision is entirely yours and your family's. Veterans, you worked hard and sacrificed so much for this country. Make sure you understand every benefit you have earned and don't hesitate to use those benefits when you need them the most. Today's discussion is meant to help you understand the questions you should be asking. Every insurance plan is different. Every state has different programs. And every person's situation is unique. I will include a CMS resource below that explains palliative and hospice care in more detail. But remember, reading a guideline is never a substitute for calling your own insurance company and asking exactly what your plan covers. There is so much more to talk about, and we will continue answering these questions in future episodes. If you found today's video helpful, please like, subscribe, and share it with someone who may need this information. This is Rupal. I will see you next time.